And now for the latest on the pandemic and what's next, we welcome back Lieutenant Governor and the state's COVID-19 liaison, Dr. Josh Green. Good morning, Lieutenant Governor. Happy New Year to you.
Happy New Year.
Now, the surge in cases continues. There were celebrations across the state for New Year's. Will we see numbers go up even higher later this week or next? And what can you expect in terms of numbers? How high could we see these numbers go?
Well, the numbers can go very high because Omicron has an R0 of 10, which means for each person that gets infected, 10 additional people that they've come into contact tend to get infected. The infections have been less severe, but not without risk, especially for older people or for individuals who are not boosted. Those are some of the things we should focus on. I would expect that based on the projections that HIPAM has done, we'll see surges all the way through mid-month. At that point, they should begin to come down slightly, and then the hospitalizations will follow. There is a bit of silver lining here, and that is that when we peaked with our hospital numbers, when people were severely ill in early September 3rd, we got to 448 people in the hospital out of 11,500 active cases. So consider that compared to now, where we have 175 individuals, yet we have 25,236 active cases. So the hospitalization rate was about 5 times higher then. But still, people need to get that booster because if they get a booster, they're protected from getting severely ill.
Having said that, does that mean hospital capacity right now is pretty good? When will healthcare workers be arriving to help?
So pretty good is a relative statement because a lot of people are catching up on their old health problems from the last 2 years. So the hospitals are a lot more full with just regular health problems, just not quite as full with COVID. COVID cases were 3 times higher at our peak before. We do expect to get this extra help. The Department of Health has to finalize their recommendations in the coming couple days. And there had been discussions about getting some of the visiting or traveling nurses and respiratory therapists about mid-month. So we'll have to check back in with the Director of Health after this long holiday weekend. But that's what the Healthcare Association and others have been recommending. We did suggest that we need as many as 717 additional healthcare workers just to help us through boosting, testing, and anything COVID related. It makes sense because the very last thing we want to do is ever have that discussion about rationing care again.
So we could see more than 700 maybe next week arrive.
I think that would be optimistic. You know, I do know that Libby wants that kind of support, and we do know that it's also very difficult to compete and get visiting nurses or traveling nurses here or anywhere right now because in most parts of the country, it's even worse. We have a high rate of cases right now, but if you look at it historically, we've got the lowest rate across the whole pandemic, and we're doing okay with our hospitals. Every other state, especially the states that are very poorly vaccinated, are really struggling.
Let's talk about schools starting this week. The DOE decided to continue with in-person learning. Do you agree? Is it safe for kids to return to in-person learning?
I have 2 children in school. I have a 14-year-old who's almost 15, and then Sammy, who's 11. Sam caught COVID in school several months ago. He didn't have many symptoms at all. He was confirmed because of good contact tracing, so that's the model. Do I think it's safe to go to school? Well, children have not gotten severely ill, but I'm not going to judge any parent if they choose to keep their kid out of school for some time. I think options have to be made available to all of our families. Distance learning is pretty good too. Overall, though, people who are vaccinated, and 70% of our children aged 12 to 17 are fully vaccinated, 69.7%. So they're very well protected. And as you just described, they're going to be also eligible for a booster in the very near future if it's been more than 5 months. Children 5 to 11, a little less so. They're only vaccinated at a 30% rate with that first shot. So I'm a little more concerned about them. But to date, we've only had a very small handful of children get sick enough to seek medical care. Even 1 is too many, but we only had 2 children in the hospital recently at Kapiolani. So we have to educate kids. We have to help them with their psychological health and their intellectual health. It would be very hard to walk away from school.
So you would say it is safe for kids to return?
Our kids will be going to school, and so that's an indication I do feel it's safe. But don't be surprised if children get a mild case of Omicron during the next few months.
Speaking of kids, the FDA just approved boosters for 12 to 15-year-olds. How will this help the vaccination rate?
It will help it a ton because those children aged 12 to 17, 70% of them are essentially eligible for the booster, and they should all get it. Our child definitely will. it's very helpful because it prevents severe illness in older people. It will also prevent more severe illness in young people. So I would hope that everyone would get it. We're stuck down around 350,000 individuals in our state that have gotten the booster, and we have 97,000 children in the age 12 to 17 range that could get that booster. So it's really good for all of us if more people get boosted.
Now, having said that, let's talk about those boosters in Maui County, because residents there will soon need to start showing that they have their booster shots to enter some businesses. I know you're leaving these decisions up to the mayors. You said, you trust in their decision making, but should all the counties be doing that? Will that help cut down on the spread and encourage more people to get their boosters?
Yes, I think it was very smart what Mayor Victorino did, I have to say. I want to give him special credit for being bold. That's what the standard should be nationally, and it probably will become national sometime this winter. I wouldn't be surprised it's about February 1st, where having 3 full shots is the standard for being fully vaccinated. So good on Mayor Victorino for practicing good public health, and I think all the counties will probably get there in due time.
All right, if that happens, of course, we will let everyone know. But thank you so much, Dr. Green. We always appreciate your time and your insight.
You bet. Thank you.